Here at Children's Specialized Hospital, we have an amazing rehab tech department. They help make sure our children are able to get up and out, navigate their environment, that any equipment they may need while they're here is really customized to them for their entire stay.
Rehab tech acts as an in-between. We're between the therapist and the equipment and nursing and the equipment. They tell us what they need and we find the equipment and make the equipment do what they need it to do.
We take care of kids and help them get moving again. Kids come here that have had devastating things happen to them. And part of the whole point of rehab is we're done with being in the acute hospital. Let's get out of bed.
Dave realized I needed a power chair and he basically fitted one for me, and within like the day or two I started to get used to it.
We customize a lot of normal equipment. We have a whole fleet of wheelchairs and supportive strollers that we customize to fit, but we also build a lot of things. We work with wood, foam. We carve foam to match people's body contours.
Teresa or Dave, after they have an eval with individual patients, and whatever they come up with, they'll give it to me and I'll build it for them. And then they'll go fit it. And if there's any modifications afterwards, we'll take care of that also.
Not all of our kids fit in a normal way in equipment, either because of different body shapes that they might have, or they may have fixators attached to their body after a fracture or a surgery that makes their body in a different shape, so normal equipment doesn't work for them.
Sometimes it's as simple as we're bringing a baby stroller up to our room and a nurse sets it up, or it can be as complex as making something completely custom.
The innovation between Teresa and Dave and what they do with these children is just, to meet their needs, it's just amazing.
We've had kids who have felt almost worthless because they're not able to do what they used to do before. And we're able to give them a piece of technology and they're able to function again in some way.
There's these switches on my head. If I hit the left one, I'll go left. Hit the right one, go right. There's a little button in the back of my head, and basically you like tap it and then hold to go forward, or you would tap it and then you could go back.
It's very fulfilling. We had a girl come in and she has only been able to sit in her chair for 5 minutes before the pain was too much. I carved a lot of foam, followed her body contours, and she was able to sit for 3 hours, which means she'll now be able to go back to school and be out of the house and not stay in bed. So it's things like that that are life-changing.
Rehabilitation is about getting the children up and back into their communities. And in order to be successful in your community, you need to be able to get around your environment. And that work starts here, to learn how to navigate a wheelchair if you've never used one before, not just to get up and down where you're going, but really interact with your environment. But also too, a lot of the equipment they help with helps position children in ways that allow them to continue to make gains while they're here. You may not see someone from Rehab Tech every single day, but the work that they do helps every single discipline help that child continue to make progress and gains. We really couldn't do the work of rehab without our Rehab Tech department.